Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I'm a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead. And if you're new to my channel, I just share my advice, teaching, tutorials to help you self-study and pass your exam for free. I also provide independent one-to-one tutoring for OSCE preparation, as well as academic support as well for UK university students. So in this video, I'm going to do an evaluation demonstration for end-of-life care scenario. So I always get quite a few emails about evaluation. Sometimes nurses find it tricky. Don't panic. Evaluation is super simple. What we need to do is hand over our assessment, planning, implementation station, and then think about the ongoing nursing care and recommendations for that patient and use the SBAR structure. So remember, you'll have all your paperwork, you'll have everything in front of you. We're just handing over what we've done in those other stations and then thinking about what we need to hand over to the other professional in order for that patient to continue to have safe nursing care and continuity of care. So this is 8-minute station. You can have some silent planning time, but you must leave enough time to verbally hand over. Okay, I've got my 8-minute clock there. I'm going to get up my briefing. Okay, I'm going to start my clock, start a bit of planning, and then we'll go into my evaluation. I'm just going to read through my scenarios. I've got Robin, stage 4 colon cancer. She was admitted with shortness of breath, constipation. She spent 2 days. Okay, so she's 2 days further on from my assessment station on the wards, now ready for discharge. She's been treated with laxatives and suppositories. I'm handing over to the community palliative care nurse in preparation for discharge. Okay, quick check through the observations. Okay, so everything is relatively fine and normal, so that's good. I'm just going to refresh myself. So you'll be doing this silently in your planning, but I'm just going to refresh myself on my planning and my assessment information. So she came in, emergency department, constipation, distended abdomen. So she's got do not return resuscitation order. So I need to make sure I hand that over. That's very important. And I'm going to check my observations on my assessment. That's fine. I'm going to revisit my care plans I wrote for her. So here I wrote constipation and end stages of life and dying and all the problems with shortness of breath. So I'm going to make sure I hand those over. I'm going to review my medication chart and I'm just going to identify which medications I gave. So she had, for me, paracetamol, and then she had some as required metoclopramide. Okay, I'm going to think about my recommendations for this patient. So I'm definitely going to want to do kind of continue monitor her at home. They need to follow up her palliative care, review her bowels, pain management, pain is very news to, and other kind of symptom control. Oh, and there's symptom control. So I'm just putting a few pointers there just to remind me what I need to do. Can't type today. Okay, so I think I'm ready to start handing over. So I've got just 6 minutes on the clock. So, okay, so examine, I'm ready. So, hello, my name is Hannah Ames. I'm the registered nurse working on the medical ward, and I am handing over my patient who is called Robin Thomas, date of birth 14th of 2nd, 1955, hospital number 1469581. So I'm handing over Robin. She is got stage 4 colon cancer and is in end-of-life treatment now. I'm handing her over to you for her preparation for discharge back to home and to follow up in terms of her palliative care nursing needs. So Robin was admitted 2 days ago. She presented to the emergency department via her GP with shortness of breath, history of not eating. She's, like I said, had colon cancer for 2 years, and the cancer has now spread to her liver and lungs. She's receiving palliative care treatment. She had abdominal pain and severe constipation. She was also short of breath. Robin has a do not attempt CPR order in place, so she's not for resuscitation, so please make sure that is noted down in your notes. Her past medical history is colon cancer, diagnosed 2 years ago, and she's had an appendectomy 20 years ago. Social history, so she lives alone in a house, no social service support. Son lives in the US and rings once a week. Husband died 2 years ago in a car accident. She used to go to the local social club but hasn't been out for 6 months. Drug history, so she has paracetamol as required, Senna at night, metoclopramide 10 milligrams twice a day, and oxycodone hydrochloride 10 milligrams QDS. She has no allergies. So on my initial assessment, Robin was had increased shortness of breath with switch rate of 24, sat to 96%. Her heart rate was 80 and her blood pressure was 115/60. She was warm and well perfused. She was alert, but she had abdominal pain, scoring a pain score of 5 due to her constipation. Blood sugar was normal. Urine output was slightly decreased, but she hadn't had much to eat or drink leading up to this. On exposure, she had a fairly distended and abdomen due to constipation, but no other wounds or injuries. Her new score was 2 because of her respiratory rate, and like I said, pain score was 5. She was physical issues with shortness of breath, constipation and pain. She was worried about her daughter and son who live in America, not being able to travel over and visit her in time, and she said she wanted to be nursed at home, and she had no spiritual needs but requested to see the chaplain. So she's had 2 days in hospital and she's been treated with laxatives and suppositories, had her bowels open, and her current observations are respiratory rate is 18, which is reduced, saturations are 95%, down very slightly but still within normal, heart rate is 80, which is the same, blood pressure is the same, 115/68. She's alert and her temperature is 37 degrees, and her pain is down to 2 out of 10. So her main nursing needs have been her constipation. She's not had her bowels open for 5 days, so we had administered her prescribed laxatives and suppositories. We had commenced a fluid balance chart and tried to promote and increase her fluid intake. We'd also encourage her to increase her fibre intake as well. We got a review of the medications to see if there was any alternative non-opioid medications. Robin's other main nursing need has obviously been that she's in end stages of life and dying due to advanced cancer. So we've tried, we have discussed with Robin her plan of care for her end stages of life. We've assessed her regularly using the Universal Pain Assessment Scale, and we've managed her pain. We have discussed with Robin her wishes, and she wishes to remain at home, to be nursed at home, and we are escalating to you as the palliative care team as well to support her with that. And she didn't have any specific spiritual wishes, but she did want to see the chaplain, and we have arranged that. We've made sure that her Robin is aware of her do not attempt resuscitation status, and this has been communicated to all staff. So medications I have given Robin include just paracetamol at 6 o'clock, 1 gram. She was also feeling sick, so she had some metoclopramide as well as required medication at 6 o'clock as well. So Robin, I'm handing her over to you for ongoing care. So I'd like you to assess Robin within 24 hours of discharge into the community, see how she's managing at home. Please review her bowels and follow up with her Bristol stool chart and make sure she's having a regular bowel motion. Please assess her pain, so and make sure her pain medication and her pain is well controlled. Can you complete her news 2 every visit just to rule out any other symptoms? And can you support Robin with her end-of-life wishes as well, and in allowing her to communicate with her son and daughter? Can you please make sure all the team are aware of her do not attempt resuscitation order as well? Is there any other information you'd like to know? Okay, thank you very much, and that's the end of my handover. Okay, so that was my evaluation run through for end of life handover. To see how I just went through systematically, used my paperwork to support me. So assessment station, well, evaluation station first for my situation, assessment paperwork for my background. The assessment part of the SBAR is drawing on your new evaluation observations, your care planning, interventions you've made in your holistic assessment, and the medications you've given. And the recommendations is your ongoing nursing care for that patient following you handing her over to the new healthcare professional. If that was helpful, please like, share, subscribe my videos, drop in the comments any other videos you'd like me to do and demonstrate for you. And if you want some additional support with your OSCE preparation, then please do contact me for my one-to-one tutoring support and packages.